Hello and welcome to Legislative Report. I'm State Representative Keith Gillespie of the 47th District in York County. Today's topic is one that often doesn't get discussed, but in order to combat the epidemic of suicide, we must have an open dialogue about its scope and warning signs. My guests are here to educate us all with the hope that lives will be saved. Joining me now are Rich Robinson and Lucy Cadwallader from the York County Suicide Prevention Coalition. Thank you both for traveling up and joining us in Harrisburg today.
Thank you very much for having us.
Rich, I know you've been involved with the coalition since some of its early stages. When was it formed? About 5 years ago, I understand?
About 5 years ago, late 2007.
Okay, and I know one of your colleagues that was unfortunately unable to join us today, Cindy, was very much involved with the inception because she had noticed, and you had noticed in talking with her, an issue of suicide among the elderly.
We did. We were looking at figures in York County and noticed that there was an elevated rate for suicide among people over 50 years of age, and started looking into that and tried to determine what the causative factors were. And the longer we got involved with that particular element, the more we realized that suicide in our community was a significant problem.
And significant is indeed a problem. Do you find that well, first of all, I mean, how many suicides are we looking at a year in York County?
York County has been averaging between 50 and 60 for the past 10 years, although I think it was 2009 there was an elevation where we had 75 deaths. Last year alone we had 58. This year, unfortunately, we're already up to 22. The other statistic that we find alarming is that as of today, there have been 8 murder-suicides in the state of Pennsylvania. 3 of them occurred in York County.
Yes, unfortunately, we just read about those just prior to this taping, and extremely unfortunate. Lucy, I know, unfortunately, you got involved with this, probably not the way that you wanted to. You're the mother of a suicide victim. And maybe if you can just tell us a little bit about your experience and how you've turned that and now working with the coalition to prevent or at least bring awareness to suicides in York County.
Yes, I noticed that most people won't talk about it. Soon after my son took his own life, people didn't know what to say. People would go the other way in the supermarket, go down the aisle, and I can't, blame them for that. I didn't know what to say back, but the whole point of getting involved with the coalition is to get a conversation going with people about suicide, about mental health, and how people, whether it be in the community or legislative or EMS, anybody, friends, family, start a dialogue and get educated on how they can help people in need. There are risk factors, there's warning signs, and unless you're aware of those, it's difficult to always see when somebody's hurting.
Yeah, I imagine one way to equate it is like the elephant in the room, that
Yes.
nobody wants to talk about it. And again, I applaud your efforts for traveling here today and sharing your story, and again highlighting hopefully some things that we can do to prevent another family from having to experience what you and your family have done. Okay, who is at greatest risk, if we can just maybe start there, Rich, in your opinion?
Well, statistically, white males over the age of 50 are at the greatest risk.
Okay.
They're statistically 3 to 4 times higher than any other age demographic, or certainly they outdistance women.
Okay, any reason why they would, I mean, I know that's what the statistics are showing, but any reason why the white males over 50 are in such a category?
We're really not absolutely sure why that is. There are probably a number of different factors involved, but one of the common threads I think that emerge in everybody who's at risk for suicides is a high incidence of mental illness. 90% of people who take their own lives or attempt have some mental health diagnosis at some point in their lives. So that's one factor that I think we have to zero in on.
Yeah. There's obviously costs associated with suicide. What would some of those costs be?
Well, last year in York County, according to the Pennsylvania Department of Health, the figures, the cost for self-inflicted injuries reported by a York hospital were in the neighborhood of $5.2 million. Now, that doesn't mean that everybody was trying to take his or her own life. I mean, if I went out and tried to undertake a carpentry project in my backyard and put a nail through my hand, which I can, that would be a self-inflicted injury. But we're pretty sure that a lot of those injuries are self-inflicted in an attempt at suicide. So that figure is $5.2 million. What stands out to us is the cost associated with assaults was only $2.9 million. So there's a real economic cost involved in all of these figures that we're talking about today.
Yeah, that is significant, that demarcation. And I know one thing that rang to me with some of the numbers that you were proposing there with the number of suicides last year, and of course we don't know how many were attempted or could have been masked under other auspices, is very similar. In fact, probably ahead of the number of people we lose in automobile accident cases each year.
Nationally speaking, that's true. Unfortunately, in York County, suicide fatalities and traffic accidents are neck and neck. I think last year's traffic fatalities were a little bit ahead. But the national trend is that traffic accidents, traffic fatalities are going down across the country. Suicide numbers are going the wrong way. They're going up.
Right. Now, Lucy, you've been with the coalition now a couple of years, I guess.
Not quite that long now.
And again, I know your history, but you were obviously drawn to this to feel that you could offer some assistance, not only from a personal perspective, but through a desire to do the work that you do.
Yes, the coalition has a suicide survivor support group that is the third Wednesday of every month, right there in Shrewsbury. It's open to anyone.
And where is that in Shrewsbury? Where do they meet?
It's on the main street. It's the old library and it's old bank. I have them.
We'll get that address and put it up on the screen. Okay.
But by attending those meetings, it's people who we call ourselves survivors of suicide. It could be people who have even made the attempt and want to come and hear and be educated, know that there's people who care and are listening, and how they can get help. And for me, being part of the coalition and attending their conference last year and being on the panel, a lot of people have approached me, whether it be on the social media or by phone call or directly coming up to me and letting me know that they appreciated the word getting out and asking me questions on it. What are the warning signs? What are the risk factors? What can they do in the situation? And also giving help to those who have survived, the family members who have to go on and deal with the grieving process. As I was telling you, it's a disservice to someone by telling them to move on and to get over it, because there is no timeline for grief. People do that in their, as they overcome certain obstacles, whether it be the anger, the depression that goes with the grieving. And I guess I reassure people that life will go on, life will get better, but you have to respect yourself and what you're going through at that time. And in order to work through the grief, it makes you a stronger individual in the long run. You just have to give it time and to have someone there to help you through it.
Right. Obviously something that's extremely personal and different to each particular discipline and person affected by it.
Yes.
Lucy, since you mentioned it about warning signs, what would be some of the warning signs that the viewers that are looking at today would want to maybe look as a red flag or a possible indication that somebody might be contemplating suicide? There's
actually quite a few, and it could be one or a combination of some. Depression is really the number one key warning sign, that hopelessness and a lack of interest in things that you were once passionate about, a change in appetite or sleeping patterns, giving your belongings away, or talking about or writing about death are all key signs. Drug use or reckless behavior. If a student's in school, their grades going down, or if you're in the workplace, poor job performance. And withdrawing from friends or family, just pretty much alienating yourself, from others, are all definite warning signs. And then the risk factors, the loss of a friend or a family member or another unexpected tragedy, a previous attempt, a history of mental illness in the family, or attempted suicide by a family member, a loss of a job, even retirement. People have free time and, or whether they left retirement on their own or not. Divorce or the breakup of a relationship, harassment or bullying, whether it be at school or the workplace or even elsewhere. That's been very common, unfortunately, with kids in college or even in the high school or middle school. When someone has had trouble with the law, or if they're a victim of crime, those are all big risk factors on whether they could be suicidal.
Well, that was a very comprehensive list, Lucy. Rich, anything to add to that?
That pretty much covers it. The one thing that I would stress is the incidence of substance abuse or alcoholism. I think more and more we're beginning to see that could be a red flag for a deeper, more systemic problem. I think a lot of times we have a tendency to dismiss it or judge an individual as being morally weak. It could be deeper than that. There could be a much more serious mental illness at stake there at present. And that substance abuse or the alcoholism is a red flag or a marker for that.
Would you look at that as maybe a change, an increase in substance abuse or alcohol abuse, or just someone who, routinely maybe imbibes more than what one would look at as maybe being socially acceptable?
Well, I think people who imbibe a little bit more usually can function. And I think for a lot of people who can't, the substance or the alcohol is a way of coping with that depression or that mood disorder. So it's a little bit more serious than one too many at the office party, I think. It's much more pervasive.
We talked a little bit about the workplace, and or Lucy, I'm sorry, you had mentioned that people sometimes, if they lose their job or they retire, but from your work with the coalition, what can workplaces do to prevent suicide?
Well, first of all, pardon me, educating the workforce, educating the administrative staff, I think is key to changing the attitudes at the workplace, to take it seriously. Should suicide prevention be part of any company safety policy? We think it should, because it's important to a company. When you lose a worker, you're affecting and influencing your productivity. You're going to lose that worker. Also, the coworkers, the people who have worked with that person, are going to be influenced as well. So it's not just an isolated problem. It's going to affect everybody. When you lose one of your own, a lot of people in the workplace are influenced and affected. The other thing I would add there about the workplace, because we have a tendency to concentrate on companies and corporations, I think we should also consider our schools as workplaces for our teachers, our guidance counselors, and our coaches to try and recognize onset signs in their students. Because we're beginning to recognize that for most people, or for 50% of people who experience serious mental health issues, the onset is during adolescence, 14 or 15 years old. Mm-hmm. So the signs come in very early. We have to do a better job of looking for them.
Okay. Well, we're going to pick up on that in just a moment, but let's take a short break. Legislative report will return in a moment.
know that Violet Oakley was the first female artist to receive a large commission for artwork done in a United States Capitol building? In 1902, Joseph Houston, designer and architect for the 3rd Harrisburg Capitol building, commissioned Violet Oakley to paint murals for the governor's reception room. He believed that Oakley's contribution would add interest to the building and act as an encouragement of women of the state. Prior to beginning her work for the Capitol, Oakley set out to England to conduct research for her murals. Upon return, she decided to center her artwork on William Penn and the founding of Pennsylvania. Oakley made sure that Penn's ideals of justice and peace could be seen throughout her work. In 1906, she completed 13 murals titled The Founding of the State of Liberty Spiritual and was placed in sequential order around the governor's reception room. These murals were some of the first to be installed in the Capitol. When Edwin Austin Abbey, another artist for the Capitol, died in 1911, Oakley was offered another opportunity to create murals for the unfinished Senate and Supreme Court chambers. Her work on the Senate murals, including International Understanding, was completed by 1919. Oakley then completed the Supreme Court murals, including the Divine Law, by 1927. Oakley is said to be the principal artist for the Capitol, with a total of 43 murals on display. She remains one of the greatest muralists in the United States. Now you know.
Welcome back to the program. I'm State Representative Keith Gillespie. We're discussing suicide prevention with my guests, Rich Robinson and Lucy Cadwallader. Folks, welcome back to the show here.
Thank you.
Rich, I know just before the break there we were talking about what can workplaces do to prevent suicide, and you also mentioned about schools and adolescents, and maybe we can just finish up with our discussion there.
Well, one of the programs that we think is really helpful in the workplace and could be helpful in schools would be a program known as QPR, which stands for Question, Persuade, and Refer, which really is designed to help people identify those of their colleagues in the workplace or students who may be at risk, and to try to start an earlier intervention process so that those individuals can be referred to appropriate sources of help.
Okay, and for those folks out there that may be like human resource managers with companies or wellness program directors with companies, who may they contact to get information on this QPR?
I would certainly recommend Cindy Richard, who's the Director of Southern Community Services in Shrewsbury. She could be reached at area code 717-227-0048.
Okay, great. And I understand you don't have a specific website, but people can access your group through the www.pen-mar.org, and then go to the Southern Community Resources link,
right,
and they'll get hooked up with you guys.
Yes, they'll be set up that way. Southern Community Services is actually a division of Penn-Mar Human Services.
Okay. And are there any fees associated with any of the programs that you do? Is it all volunteers?
No, there's no fee involved at all.
Okay, so you guys are doing this out to help with awareness.
Public service.
That's just fantastic. Lucy, I know we talked a little bit during the break about why is it so hard to get help, and it's like some various biases that are associated with asking for help with suicide prevention.
I think it's mainly due to biases, discrimination, and the stigma that's attached to mental health and even the word suicide. People are uncomfortable bringing it up. I recently read it was a local magazine, and it was all about depression. It was a woman's magazine, and not one word was mentioned about suicide, and in their resource part, nothing about the suicide hotline, and there's such a coalition between, a correlation,
Sure.
between the two, that them not mentioning it, it stood out very prominent to me that it wasn't brought up, and it was about 2 pages long, and for me it was just obvious that it was not mentioned, and I think people overall become very uncomfortable in speaking about it because it's not been brought up enough. People have not been educated, and that's, I think, a big part of the coalition's role is to make people come forward who need the help.
Again, it's that elephant in the room.
Yes, most definitely.
Nobody wants to talk about it. Your services are available to anybody in your county, and I would assume I'm getting it from the both of you. You'd even go beyond the county borders if you thought you could help somebody with with some awareness and so forth.
We
as
would,
such.
yes.
Most
I
definitely.
mean, how often are you guys running programs that, are you busy? Are you, is this something that, you wish you were more involved, or maybe you can comment a little bit about the activities of the coalition?
Well, as far as our activities, we've held a conference in York for 5 years running. Coming up in May, we'll have a forum devoted to this subject. We've also had a series of what we call lunch and learn programs that deal with different topics. This year we've had a series of 3 so far. The first one dealt with domestic violence and suicide. The second one dealt with military and suicide, the incidence of suicide in the military. And the third one,
Was the workplace.
had
Okay.
to do with the workplace.
So these lunch and learns, how does somebody get tapped into attending one of those?
You could either call Cindy Richard at Southern Community Services or access the information on the website, and they're open to the public. Now, for the lunch and learns, there is a nominal fee, but we think they're very worthwhile programs that, again, help get the word out and increase awareness of the scope and significance of the problem.
Okay. You mentioned about an annual conference that you guys have been holding. Tell me a little bit about the conference. You said you've done it 3 years running now?
5 years, actually.
5 years running,
yeah.
I'm sorry.
These conferences are day-long conferences and involve a number of different workshops that deal with different subjects. We also have a keynote speaker that will speak directly to one particular issue or aspect of suicide or suicide prevention, so that we try to provide a little bit of everything for different population segments in the county, healthcare providers, parents, just people who are interested.
Yeah, we had people in the military. We addressed that at the last conference. We even had a retiring police officer talk about the suicides that, because of the stress that the police have on the job and the number of suicides. And as I was mentioning prior to this, about we had a panel of family members who had lost loved ones to suicide, and they directly told their stories, or just different insight as to what could be changed, whether it be in the medical profession or in the schools or wherever it touched their particular story. And I had quite a few people confront me about well, my topic was what to say to someone who has going through the grieving process, and how to address them with a more sympathetic ear, as in obviously not telling them to get over it or move on, but to know that there's no timeline for grieving, especially the loss of a suicide of a child. That's something that you carry with you the rest of your life, and you have your ups and your downs and highs and lows, and people need to understand that.
Yeah, I think you had shared with me earlier about running an individual, and the individual gave you a hug and didn't say a word, but that just meant so much to you to know that even subliminally it was acknowledged.
Yes, it goes a long way.
It goes a long way. Okay. Now, 2 things. I know we're getting close on time here that you had mentioned, and Rich, you had cited it earlier about the 3 unfortunate cases we've had in York County of domestic violence ending up in a murder-suicide. And you've done workshops, lunch and learns on, just some key warning signs for domestic violence. And before you answer, the reason I ask that is I sit on the York County Domestic Violence Fatality Review Board, and one of the things that we look for is a common theme or denominator so that we can arrest that and hopefully prevent murder-suicides from happening. But I'd be interested to hear of any thoughts that you may have relevant to that issue.
Well, that's a great question. I want to choose my words carefully, because we know statistically that firearms in the household can be a factor, and especially if a relationship or a marriage is starting to experience problems. That's a problem that we have to be aware of. And I think the facts speak for themselves. 8 in the state, 3 of them in our own county. So it's a warning sign. The accessibility of that kind of destructive firepower is something that I think loved ones or members of the community, neighbors, have to be aware of. Okay. It is a warning sign.
Well, the warning signs are very similar to the ones for anyone who is suicidal. The risk factors are repeated arrests for assault, a diagnosis of depression, a loss of employment, and then also a history of domestic violence or the bullying. There's even a large number of suicides in if it was a woman being with the domestic violence, the suicide rate is very high for her and also children who've been exposed to it, and because they basically feel there's no way out other than taking their own life. So it's a real desperation at that part. And for the children, it could be at that time of it occurring or years later. Unless help is given to the individuals, it's just something they'll carry around with them for the rest of their lives, and eventually, other factors may come into it to just escalate the situation.
How unfortunate. And we're getting down close to the end here. We read also, unfortunately, of our military, coming back from serving overseas or maybe even serving here, being away from their families, and a high incidence of suicide among the military. Any comments relevant to that, or warning signs, risk factors that we need to be aware of?
I think the issue that stands out to us more than anything is that we've heard a lot of talk from high-ranking military officers about their addressing the problem, but there's still a stigma involved in the ranks, an admission that a soldier needs help. It can be interpreted as a sign of weakness. We've heard too that there's a generational divide too. Younger military personnel are much more sympathetic, much more astute in discovering or recognizing warning signs. Older military non-coms and junior officers aren't quite so sensitive, and might say to a young soldier that it's time to suck it up and get beyond it. These are in units that have already experienced a suicide among a platoon or a company. So I think there's a lot of work, a lot more work that probably has to be done in taking it seriously. Quite a few friends of mine who've been in the reserves or the National Guard or even serving on active duty have mentioned that when they went through the lecture, the suicide prevention lecture that they had to sit through, the attitude was, all right, one more that I got to sit through, and they didn't take it all that seriously. And when it happens in their platoon or their squad, they wish they had. But of course, by that time, it's too late.
Very unfortunate. Sorry, we're out of time. But that's all the time we have for today's program. I'm State Representative Keith Gillespie. If you have any questions about today's show or any state government matter, feel free to contact me at my local office or through my website. The information will be shown in a moment. Thanks for watching, and please join me next time for another edition of Legislative Report.